Today we will be discussing about Eustachian tube function tests. Eustachian tube function tests are Valsalva maneuver, modified Valsalva maneuver, Politzer test, Toyenbee test, Eustachian tube catheterization, Frenzel maneuver, Sonotubometry, Impedance audiometry, Radiological evaluation like Xray, Salphinogography, CT scan or MRI, and Saccharine or Methylene glue tests. So before starting the Eustachian tube function test, we will be describing some history about the Eustachian tube. So Bartholomeus Eustachius was an Italian anatomist who was one of the first to describe accurately the Eustachian tube and its relationship to the body. He wrote Epistola de Auditus Organis, that was the first book exclusively about ear. He also described tensor tympani, muscles and stapes. Antonio Valsalva, an Italian anatomist, divided the ear into three parts, the outer, middle and the inner ear. He wrote the De Aurea Humana, describing anatomy as seen in over 1,000 temporal bone dissections. Applied the term labyrinth to the entire inner ear. The parts of the cochlea were named as scala vestibuli and scala tympani. He described the muscles of the pinna. He named Eustachian for the pharyngotympanic tube in honor of Eustachius. He was the first to demonstrate the presence of ankylosis of the stapes at postmortem. He suggested the use of the method of blowing out strongly while holding the mouth and nose closed, forcing the air to pass into the middle ear by way of Eustachian tube when it was blocked. This method is popularly called the Valsalva maneuver. Jonathan Wathen in 1755 described the method of introduction of the Eustachian catheter by way of the nose to the Eustachian tube. Other person is Joseph Toyenbee. He was an Englishman, dissected more than 2,000 temporal bones and formed the collection which became known as the Toyenbee collection in the Museum of the Royal College of Surgeons. In 1860, his work Disease of the Ear was published. He noted that the Eustachian tube was not permanently open but lightly closed, and that it opened only during such movements as swallowing or yawning. In one of his dissections, Toyenbee recognized a fistula of the external semicircular canal, and he pointed out that infection could extend to the brain by way of the labyrinth. Toyenbee was one of the first to describe otosclerosis, and he recognized it in 160 cases. While trying to treat his own tinnitus experimentally by inhaling chloroform and performing Valsalva maneuver, he died. The other person of importance is Adam Politzer. He was a prolific author and a teacher. His name is associated with Politzer bag, cone of light, speculum, and the test for unilateral deafness. He introduced one of the first mechanical audiometers. He correctly described otosclerosis as the disease of labyrinthine capsule rather than being secondary to chronic middle ear catarrh, as was thought previously. In 1896, he first published Atlas of Photos of Tympanic Membrane by Illumination. So now we will be describing about Eustachian tube function tests. So these are the common tests that are performed. So some of them are clinical tests and some are investigations or radiological tests. So we will be describing accordingly. Valsalva maneuver. The principle of this test is to build positive pressure in the nasopharynx so that air enters the Eustachian tube. To do this test, patient pinches his nose between the thumb and the index finger and closes his mouth and tries to blow air into the ears. So let's see a video here. So Valsalva test can be done by closing the mouth, pinching the nose, blowing air towards the ear. So if the patient hears a pop sound or there is fullness, then the Eustachian tube is found to be patent. Let's see this. Okay, so that is how you do it. If air enters the middle ear, the tympanic membrane will move outwards, which can be verified by otoscope or the microscope. This can also be confirmed by asking the patient about fullness in the ear. In the presence of a tympanic membrane perforation, a hissing sound is produced, or if discharge is also present in the middle ear, crackling sound would be heard. Failure of this test does not prove blockage of the tube because only about 65% of the persons can successfully perform this test. So here you can see a perforation in the tympanic membrane. There is some discharge here. So here you can see as the person is doing Valsalva maneuver, you can see bubbling through the area of opening of Eustachian tube. Okay, in the case of perforation of tympanic membrane. In this area, that's the bubbling. This test should be avoided in following conditions: in the presence of healed or atrophic tympanic membrane which can rupture, in the presence of infection of nose and nasopharynx where infected secretions are likely to be pushed into the middle ear causing otitis media. Okay, so the other test is modified Valsalva maneuver. So the principle of this test is similar to that of Valsalva test. To do this test, patient pinches his nose between the thumb and index finger, takes a deep breath, closes his mouth and begins to gently blow the nose, gently raising the pressure. If unable, add strong swallow while gently blowing. The other common test for clinical assessment of Eustachian tube is Politzer test. So for Politzer test, you require a Politzer bag. It's a rubber bulb-like instrument with an olive bulb as a nose piece. So the nose piece is inserted into the nostril and then this bulb is pressed so that air enters into the nostril and to the nasopharynx, and from there through the nasopharyngeal Eustachian tube opening into the middle ear. So its uses is to test Eustachian tube function and sometimes as a treatment of Eustachian tube blockage as well. So for doing Politzer test, nose piece is inserted into nasal vestibule on the side of the Eustachian tube to be tested. Other nostril is closed to prevent air leak. Then the rubber bulb is now pressed and at the same time the patient is asked to swallow, or the patient is asked to say ik 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 or k k k. So here you can see the demonstration of this test. The patient presses it in its nostril and then presses the rubber bulb. Okay, so the test would be positive or the Eustachian tube is patent when there is fullness in the same ear. So by means of an auscultation tube connecting the patient's ear under test to the examiner's ear, a hissing sound is heard if the Eustachian tube is patent. This test can also be used to artificially ventilate the middle ear. So if the auscultation tube is not present or not available, then what you can do is ask the patient if there is some hissing sound or ear fullness that is present. The other test commonly used is Toyenbee's test. So while the previous discussed test used positive pressure, Toyenbee maneuver causes negative pressure. So this test with the help of negative pressure determines the functioning of the Eustachian tube. It is a more physiological test. It is performed by asking the patient to swallow while nose has been pinched. This draws air from the middle ear into the nasopharynx and causes inward movement of tympanic membrane, which is verified by the examiner otoscopically or with a microscope. So this is the demonstration of Toyenbee's test. So as you can see, the patient is taking a sip of water which is kept in the oral cavity. The nose is pinched and the patient swallows. So if the Eustachian tube is patent, air from middle ear cavity comes into the nasopharynx through the Eustachian tube, and the Eustachian tube closes, which will cause negative pressure in the middle ear cavity, causing the tympanic membrane to go inward. So that will cause dullness or fullness. So the other Eustachian tube function test is Eustachian tube catheterization. This test was commonly used previously, but nowadays this test is not so much used, as this test is a minimally invasive procedure and can cause some complications. So the Eustachian tube catheter is used for this test. So it is a metallic catheter with a curved proximal end with a ring at its base. So the ring points to the direction of the point, the anterior end of the Eustachian tube catheter. So proximal end is curved and the instrument is usually 12 to 15 cm long. The ring on the proximal end indicates the direction of the tip of the catheter. This is not commonly used nowadays to test the patency of the Eustachian tube, as there are other traumatic equipments to do the same. It resembles the sinus dosing cannula, which is shorter and has opening not at the tip but little proximal to it. So use of Eustachian tube catheter to test the patency of Eustachian tube, to inflate the middle ear, to instill medications in the middle ear, to remove foreign bodies from the nose, or can also be used as a suction cannula. For the procedure of catheterization, surface anesthetic of nose is achieved by spraying 4% lignocaine. The catheter is then passed along the floor of the nose till it reaches the posterior wall of nasopharynx. The tip is now rotated 90 degrees medially and withdrawn anteriorly till the tip touches the posterior wall of the nasal septum. Now the catheter is rotated 180 degrees laterally, and the tip of the catheter is expected to be at the pharyngeal opening of the Eustachian tube. Then by gentle manipulation, the opening of the Eustachian tube is entered. Now Politzer bag is attached and the bag is squeezed. Sound heard on auscultation of the ear will give status of the Eustachian tube. So the findings in this test: if there is tubal blockage, no sound is heard with the auscultation tube. If there is partial blockage, bubbling sound would be heard. If the Eustachian tube is stenosed, whistling sound is heard. If it is patent, air insufflation sound is heard. Complication of this procedure: it may be painful to the patient, cause epistaxis, also cause syncopal attacks, and may cause damage to the pharyngeal end of the Eustachian tube. The other clinical test for Eustachian tube function is Frenzel maneuver. To do this test, patient pinches his nose between the thumb and index finger or uses a nose clip. Oral cavity is blocked by the tongue. Then either performing an alveolar closure, as when the sound ta or da is produced, or a velar closure using the back of the tongue. The glottis is also closed. Then body of the tongue is gently moved upwards and backwards in order to compress the air. Further compression of the air follows from moving the closed glottis upwards. So by performing this technique, the compressed air is forced into the Eustachian tube and thus into the middle ear. In situations where ambient pressure rises, typical causes are decreasing altitude in the case of airplane or increasing depth in the case of diver submerging. This maneuver results in the equalization of the pressure on both sides of the eardrum. Compared with the Valsalva maneuver, Frenzel maneuver carries a significantly low risk of overpressurizing the middle or inner ear. The maneuver can be done at any time during the respiratory cycle, and it does not inhibit venous return to the heart. Effort to perform this maneuver is minimal and it can be repeated many times quickly. So now some investigations for Eustachian tube function test. Sonotubometry. So in sonotubometry, a tone is presented to the nose and a microphone placed in the external auditory canal records the transmitted and altered sound pressure through the Eustachian tube and middle ear. The patient performs a specific maneuver like swallowing, yawning or Valsalva, and in the normal case of Eustachian tube opening, a significant increase in sound level will be registered in the external ear canal. So this is the area where noise is detected from the external auditory canal and nasopharyngeal orifice. The tone is heard louder when the tube is patent. It also tells the duration for which the tube remains open. This is a non-invasive technique and provides information on active tubal opening. Accessory sounds produced in the nasopharynx during swallowing may interfere with the test results. So the other common investigation used to see the Eustachian tube function is impedance audiometry or tympanometry. In this test, positive and negative pressures are created in the external ear canal and the patient swallows repeatedly. The ability of the tube to equilibrate positive and negative pressure to the ambient pressure indicates normal tubal function. The test can be done both in patients with perforated or intact tympanic membrane. So for this, the instrument is the same, that is the tympanometry machine. But we are not going to check the different curves like A, AS, AD, B, C in this, but we are just going to find the Eustachian tube function. So the other investigations are radiological evaluations. Radiological evaluation, so Xray Salphinogography give a single shot status of the Eustachian tube, but not of the functioning, normal physiological function of the tube. CT scan and MRI, if they are dynamic CT or MRI, then they can give Eustachian tube function test. Otherwise, they also give the dimensions of the tube and functions around it. A radio-opaque dye, example hypac or lipoidal, instilled into the middle ear through a pre-existing perforation, and then X-ray taken which delineate the tube and find out whether there is any obstruction. The time taken by the dye to reach the nasopharynx also indicates its clearance function. This test is no longer popular now. CT and MRI scan can be used to look for obstructions in the tube. The other common test that can be tried is Saccharine or methylene blue test. Saccharine solution is placed into the middle ear through a pre-existing perforation. The time taken by it to reach the pharynx and impart a sweet taste is also a measure of the clearance function. Similarly, methylene blue dye can be instilled into the middle ear, and the time taken by it to stain the pharyngeal secretion can be noted. Indirect evidence of drainage or clearance function is established when ear drops instilled into the ear with tympanic membrane perforation cause bad taste in the throat. So these tests give the function of Eustachian tube. That's it for now. Thank you.